What's going on, everybody? Today I will be talking about chronic low back pain and the 3 exercises that have been proven to be effective at treating this problem. So first things first, I will define the 3 main types of muscle contractions. So the first one is concentric contraction, and it's known as muscle contraction of the muscle as it shortens. So basically it's the flexion portion of the bicep curl, the elbow flexion. The eccentric contraction, which is the second one, is the opposite. So it's the muscle contraction on the muscle as it lengthens. So basically it's the extension portion of the bicep curl, so the extension of the elbow. And the isometric contraction is a muscle contraction without any movement on the joint. So basically just holding a weight as the muscle contracts. So that was it for the definitions. Now I will share 3 exercises that have been proven by science to be efficient at treating chronic low back pain. So it's just a reminder, so if you don't remember what is chronic low back pain, so basically it's low back pain that stays for more than 3 months. And that was my previous video, so if you didn't watch it, I will leave a link down below so you can watch it. And yeah, so if you're currently experiencing low back pain, you don't want to miss what's coming next.
On the move, don't waste my time. You can't touch this.
Low back pain is common among office workers, and it is the most common cause of work-related disability in people under 45 years of age. 2 studies suggest that instability around the lumbar spine is considered to be important in chronic low back pain. These studies have influenced researchers to dig furthermore around the chronic low back pain. That is why a 2001 study has been published by the British Journal of Sports Medicine, and they compared 3 different trainings for lumbar multifidus muscle, which is a back muscle, in chronic low back pain patients. They decided to analyze the multifidus muscle because a recent study found that this muscle atrophied in 80% of patients with low back pain. So they studied 3 groups. The first one did stabilization training, the second one did stabilization training combined with progressive dynamic resistance, and the last group, so the third one, did the stabilization training combined with progressive dynamic static resistance. So the first 2 groups resulted to have no significant effect on the size of the multifidus muscle. However, the last group, so the third one, they did have an effect. So they saw an increased volume of the multifidus muscle. So for the third group, the stabilization training was combined with a progressive resistance training. The resistance training consisted of 3 exercises. So the first one is the single leg lift bird up. The trunk lifting on the couch. And the last one was leg lifting on the couch. And they were basically assigned to hold the position in between the movement for about 5 seconds. So they were doing a tempo of 2-5-2, which basically means 2 seconds of concentric contraction, 5 seconds of holding, and 2 seconds of eccentric contraction. This study has shown that having a tempo of 2-5-2 when doing the back exercises was more appropriate to be able to increase significantly the back muscles. In this case, it was the multifidus muscle. This suggests to do this training program for the first 10 weeks at a frequency of 3 times a week. So rehabilitation of chronic low back pain is not an easy task. Low back pain is complex and depends on several factors, and the treatment has to be ideally personalized to be able to be effective. So that is why, for a limited time, I'm offering a free consultation for desk workers that feels right now pain and they want to get healthier. So if you want to learn more, you can check out my Facebook page. You can touch this. So that was it for this video. Take care of yourselves and see you on another one.